Many of us use our eyes every day, but we barely take care of them, ranging from our long hours on our phones to ignoring regular checkups. We may be damaging our eyes and we may never know it. Today, on Time with Experts, we have here a medical expert who is going to take us through everything we need to know about our eyesight. You are welcome, Doc.
Thank you very much, Francis.
Right. And we are much grateful for having you on board today.
And thank you too for this opportunity to share with your viewers something about their eye health and their vision.
All right, thank you very much. Please,
Most
can you
welcome.
kindly introduce yourself?
Okay, so I'm Dr. Francis Redu. I'm an optometrist with Healthy Eyes Eye Care and Optical Center in Cape Coast.
All right, thank you very much.
Most welcome.
All right, so we have a few questions that we want to know more about it.
Okay.
So to go straight into it, our first question is eye care all about getting glasses?
Okay, thank you very much. And I'm very happy you've asked this question because most often people have the perception that eye care is about glasses. When I go to the eye clinic, I'm just going for glasses, but that is not the case. When it comes to eye care, we have two things that we um, look out for. The first one is the health of the eye itself.
Okay.
That is the well-being of the eyeball itself, whether there's any disease, whether there's any distress to the eye health itself. After that, then we move ahead to the second aspect, which is the vision. We know that the main purpose of our eyes is to help us to see.
Okay.
That is the main function.
Yes.
So if your eyes are healthy, then we look at what can it help you to see well.
Okay.
And it is that side, that is when glasses comes in.
Okay.
So that is the vision aspect. So eye health, when it comes to eye care, we are looking at two things: the health of the eyeball itself, and then the vision, that is the function of the eye, whether you can see well or not. So that is where glasses comes in. So eye care is not just about glasses. So if you are going to the eye clinic, just take it off your mind that it's never like that.
Okay.
If there is the need for you to get glasses, then it means that your vision is not good. So maybe you can't see well at far or you can't see well at near, then we give glasses. If it is about a disease, let's say there is some inflammation going on in your eyes, then we give medication to address it. If there is the need for surgery, then we do that. So it's not just about glasses.
Oh, thank you. I didn't know about this.
Yeah.
Thank you very much. I'm sure our audience have learned a lot from this very first question. Straight to the second question. My eyes often feel tired and dry from looking at scenes all day. What can I do?
Okay, so when the eyes becomes tired, sometimes and dry as well, it usually comes with prolonged usage of our eyes, especially with the screens. Now that we are in the digital era, we switch from phone to tablet to computers. So someone will be at the office behind the computer for about 6 hours. When it's time for the person to go for an hour break, he'll switch to his phone to chat. Even when he's eating, he's still using the phone. So throughout the eye, TikTok exactly. So throughout the day, you are just behind the screen, right from work to the house, TV, from TV to tablet to laptop. So it exposes our eyes to dryness and then to digital, or what we call the digital eye strain or computer vision syndrome. So what we need to do is we need to try and then regulate our screen time. When we get some breaks, let's try not to switch from one screen device to another. Let's use that break to observe our environment, move around small, so that the eyes can get that kind of a break. And one thing is that when you are looking at something that is near like this, we do what we call accommodation. We exert some kind of effort to help us to see at near. But when you are looking at far, the muscles in the eyes relaxes. So if you look on the screens for long, the muscles will become fatigued, they will
Fatigue.
become tired.
Tired.
Then you start feeling heaviness, discomfort, and all that. So
Right.
when you take your eyes off the screen, you look around, then the eyes relaxes.
All right.
So personally, when I was in school, optometry school, um, I most often prefer studying close to the window,
Okay.
so that when I read for some time, I just take my eyes off, look at cars
Okay.
passing around, just relax my eyes.
Okay.
Then I come back to the screen. So I don't like studying in an enclosed
Enclosed
area.
environment.
No, I like open space so that I can get that breaks. And with that, you can study for longer hours without feeling any kind of
Tiredness of the eye.
tiredness and discomfort and all that.
All right.
Yeah.
Thank you very much, Doc.
Yeah. So this one is free up.
Yes. Yes. So, please, during your first submission, you mentioned that eye care is about the health of the eye and then the vision.
Yeah.
So, this leads us to our next question.
Okay.
Are sunglasses really that important for eye health, or are they just for fashion, or they are just fashion accessories?
Okay. So thank you for this question. And sunglasses were not made necessarily as a fashion accessory. They made it purposely to protect our eyes from the UV radiation.
Okay.
That is why it is inappropriate to wear sunglasses in the evening. You are going for a show, you see some of our celebrities
Yeah.
going for an awards night and
They need
wearing
good
that glasses.
sunglasses.
It doesn't make sense because it was made purposely to protect our eyes from the UV.
Okay.
So when you are going to outdoors, you can wear it to reduce the exposure. We know that global warming is depleting our ozone layer, so more harmful radiations are entering our atmosphere,
Sure.
and these radiations speeds up the aging process of the eye.
Okay.
So it causes you to develop cataract faster. There's something we call age-related macular degeneration. It causes the macula to, or the cells at the back of the eye, to break down early than they are supposed to. So
Okay.
the sunglasses is to reduce some of these radiations. The only thing is that most of the sunglasses in our markets today don't have any protection in them.
Okay.
It is just black, that is all. They are not having the UV protection.
Okay.
And that is even worse than not wearing
Wearing at all.
anything at all. The reason is that when you look at our eyes, we
Okay.
have a hole inside called the pupil.
Okay.
It is through that hole that light
Entrance.
enters to get to the retina at the back of the eye.
Okay.
Okay. When you are wearing sunglasses, what happens is that it reduces the amount of light entering the eye.
Entering the pupil.
So naturally the pupils will open, they will
Okay.
dilate, so that the small light entering will be able to reach the back.
Okay.
So if the sunglasses is not having the UV protection, what it means is that when the pupils dilate, more harmful radiations will now enter your eye and then cause more damages.
Oh, okay.
But if you are not wearing the sunglasses, because more light
Coming in.
are coming in, the pupils will constrict
Okay.
and reduce the amount of radiation that will enter your eye.
Oh,
So
okay.
before you wear any sunglasses, you need to make sure that it is having the
UV
UV
protection.
protection, or else you are rather
Causing
causing
more.
more harm than good to your eye.
Wow.
And most of those sunglasses, you see that they will write on them UVA protection or certified. There are some indications on them. But the ones on the market, and the good ones are expensive.
Oh,
It
okay.
is not the 50 CDs, 100 CDs, 20 CDs ones that we see our brothers selling on the street. So someone will go and buy sunglasses, 500 CDs. Another person will go and buy the same
Same
design,
design.
20 CDs, and he thinks that he's very wise.
Oh,
But you are exposing your eyes to more harmful radiation, and that is why I advise that if you want to get sunglasses, optical accessories, it's better you come to the clinic so that we can get you the right one, because
okay.
we are regulated, so we cannot sell anything just
To
like
anyone.
that, because we have standards that we need to meet.
Sure.
And because we are professionals, we always care about our patients. So we always make sure that whatever glasses we are giving you is offering you some of these protections so that we don't hurt our eyes.
All right, thank you very much. This one, this is very, very detailed
Yeah,
and very deep. I mean, there are a lot of things that we have to take care of. If
yeah,
not, we are causing more harm to our eyes
exactly,
ourselves.
exactly.
When I was young or growing up, I heard a lot about food that affect our eyes.
Yeah,
Somebody will tell you if you eat this particular
Gary.
food for, especially gari, for a long time,
Exactly,
it's going to
exactly.
affect your eyes. Yeah, so I wanted to know this one. I was really interested in this
Eh,
particular question.
okay,
What food are truly good for the eyes? Is it
okay,
only carrots?
okay. So thank you very much for this question, and I'll begin by debunking this myth that eating Gary spoils your eyes.
Oh,
If that is true, I'm sure I'll be blind by
yeah,
now.
because the number of gari I've chewed.
Because
Yeah,
from SS to university, Gary has been a companion.
yes.
Gary doesn't spoil the eyes.
Okay.
It doesn't have the cyanide in the cassava. That is what, when you get much exposed to, can cause retinal changes.
Okay.
But in the processing of Gary, it goes through fermentation. It goes through pressing. So all those cyanide goes out of it.
Okay.
So after the roasting process, it's 100% safe for us to eat.
Oh,
So feel free and
that's good.
enjoy your gari. Just that some
That's
people might be allergic to gari.
gari
That one is just allergies.
allergies. Okay.
But it's not that when you eat gari,
It's
you are
going to
going to
affect your
go
eye.
blind. It's never like that. So to go to your question, eating healthy for the eye is not just about carrots. We've been informed that when you eat carrots, your eyes will be good. It's 100% true,
Okay.
but it is not that eating just carrot alone is what your eyes needs.
Okay.
Your eyes needs more than carrots. Carrot contains vitamin A, which helps in our vision, in processing um, our vision. That is, it helps us to see well. But
Okay.
that is not just that. The eyes needs more vitamins like vitamin E. It needs vitamin C. It
Okay.
needs vitamin D, just to help to clear some of these oxidative stress and then the free radicals from the system, which helps to reduce the aging of the eye.
Okay.
So we are supposed to eat more brightly colored fruits.
Okay.
Fruit to be a brightly
Right.
colored, like mangoes, oranges, watermelon, grapes. Those brightly colored food, they contains most of these vitamins,
Vitamins. Okay.
which are helpful to the eye. And
Okay.
aside that too, we also want more minerals like lutein, zeaxanthin, and these ones are found in green leafy vegetables.
Okay.
So we want vegetables that are green,
Okay.
like this. Example, contomere,
Okay.
carrots, salad leaves, spinach, and all those things. They contain lutein, zeaxanthin, which helps in reducing conditions like macular degenerations, cataract formations, and all that.
Okay.
And then aside that too, we want more omega-3 fatty acid.
Okay.
Omega-3 fatty acids helps in the production of tears and then the tear film stability on our eye.
Okay.
It helps to reduce dryness
Of
on
the
the
eye.
surface of the eye. And it also has some anti-inflammatory um, properties in it, which
Okay.
helps in protecting the eyeball. And you can get omega-3 fatty acid from those fatty with fish,
Okay.
sea fish, with epumunama and guavo, like salmon.
Simon.
You see that salmon, there's a lot of oil on
Oil on
it.
the
That
surface.
oil it contains omega-3
Okay.
fatty acid. So you want us to eat more of those fatty fish, not fatty nentinam or beef.
Okay. Okay.
If you want fat, take fish.
Okay.
Fish are enama wadangwa.
Okay. Sure.
That is what we want.
Sure.
Not nentinama
That,
wadangwa.
there's difference between the two.
Exactly. Because the fish one contains omega-3
Right.
fatty acid, which helps in reducing dryness, inflammations, and all that
Okay.
on the surface of the eye. And aside that too, we also want to take in more nuts.
Okay.
Aduane a ayɛ te sɛ nuts, te
Okay.
sɛ groundnuts, beans. We want to take in those ones because they also contains other minerals and vitamins, which helps with our vision.
Yes.
So yes, it's 100% okay to take carrots, but that is not the only
Only
thing we
one.
need. If you take in only carrots, your eyes will not go well because you'll be lacking the other minerals which are needed for our eyes to stay healthy.
Sure.
So we need to eat carrots in addition to other food, and then also we need to stay hydrated. We
Okay.
need to drink more water. We need to drink more water and then eat egg. Egg contains so many vitamins. So we need to also make sure that we take that egg at least every week. We should take some eggs.
Okay.
Uh-huh.
Right. Thank you very much. Then.
Okay.
This one, my takeaway point is Gary doesn't
Yeah.
cause
Yeah.
eye problem.
Yeah.
Uh,
So enjoy your
all
garlic.
right, sure, sure. So you enjoy it. So make sure you take note of the fruits and all the food we need to take to, have a healthy eye. Now, let's move on to other questions.
Okay, sure.
So we have, what are some of the common silent thieves of sight that I might not notice?
Okay. So thank you for this question. And it is very important to note that not all eye conditions will present with symptoms
Symptoms. Okay.
or will prompt you that they are
They are
there.
coming. Okay. Or they are there.
Some will be there silently.
Okay.
By the time they reveal themselves, then it's too late.
Okay.
For example, glaucoma. Glaucoma is a group of eye diseases that causes certain changes to the optic nerve
Okay.
at the back of the eye. The optic nerve serves as a link between the eye and the brain.
Okay.
So the eye will process the information, send it to the brain via the optic nerve.
Okay.
When there's glaucoma, it starts attacking the optic nerve,
Okay.
and it does so very slowly. So let's say a day, then we one nerve. It's like having a broom there, and then you have a very stubborn child
Child
or
moving,
sibling. Every
removing
morning he goes to remove one.
one.
You won't notice it
Mhm.
because he's not taking 10 at a go,
Sure.
just one. So by the time you
You realize
realize
everything is gone.
it's done.
Sure.
And the unfortunate thing is that when the nerve dies, it can't regenerate.
Okay.
It can't be replaced. There's no surgery that can be done to
To
restore
replace
it.
the next.
So whatever damage caused is permanent. And that is why we always advise that don't wait till you get issues with your eyes before you visit the eye clinic. You need to make it part of your routine health checks so that when you come and we do the examination and some of these conditions are there,
You
we
can treat
cannot
it.
treat it for you.
Okay.
And that is why I mentioned that eye care is not just about
The
glasses.
glasses.
Some people, they would, oh, I can't see well. Then you go to roadside or a container optical shop, just go and get the glasses and go away. And those people, they can't do the examinations and all that.
Sure.
So you go get the glasses, you think that you are 100% okay. By the time you be rushed to the eye clinic, you are getting blind, and that is what we want to avoid.
Okay.
So
Sure.
something like glaucoma, silent tip of sight, and also retina and then diabetic retinopathies.
Okay.
That is hypertension and then diabetic retinopathies. When you develop hypertension or diabetes, they cause certain changes to the blood vessels in your eye. You can see this model. The lines here are the blood vessels,
Okay.
and then the orange here is the retina.
Retina.
So when you develop diabetes and hypertension, in most cases with time, the blood vessels integrity will become compromised.
Okay.
So blood will start leaking
Leaking.
into the eye.
Okay.
And at the early stages, there will be no symptoms
Okay.
because there is just blood coming. But if you don't identify it early and stop the blood from leaking, it will continue leaking, and some of the blood will cover the essential cells that helps in our vision.
Okay.
So when it covers it, then the cells will die
Would I?
and your vision will go off. But if you come for routine assessment and we
Detect it
identify
early
it,
enough.
then we can block those leakages from occurring. And that is why it is very important for that every diabetic patient and every hypertensive patient to make eye clinic visits a routine,
Everything.
because once doctor says that you have these two conditions, you need to get an eye doctor friend, because definitely some of these changes can occur.
Sure.
So when we're able to identify it early, then we can solve it for you.
All right.
So these are some of the conditions that can
Wow.
present without any symptom, but they affect vision a lot. And over the past years of practice, I've seen it so many times, and sometimes it's very disturbing when you see a condition and it's too late. There's nothing you
You
can
can
really
do
do
about
about
it.
it. And the person is eager for a solution, but there's nothing that medically can
It
be
can be
done.
done.
It's very sad. Meanwhile, if we had identified it earlier, something could have been done to salvage the situation.
All right.
Mhm.
Thank you very much,
Okay.
Doc. Looking at what the submission you
Yeah.
just gave, I can say that a lot of people are living with some conditions that they don't even know because the
So many of
symptoms
them.
have not come out yet.
So many of them.
Okay, so Doc, this leads us to our next question.
Okay.
So, for us to know that whether we have the condition or not, I
Okay.
would like to ask, at what age should we start getting regular eye checks?
Okay. So at birth, that is when we are supposed to receive our first eye examination, and
Okay.
that one is mostly done by the midwives. So they will check to see whether there's any white thing in your eye, whether the cornea is fine. That is it.
Okay.
And then 6 months time, when you come for your antenatal visit, you are supposed to come to the eye clinic for the eye professionals to also have our first
Examination.
examination.
Okay.
So after that first examination, if everything is fine, then at age 3,
Okay.
you come to the clinic. By age 3, you started talking. So we can now assess your vision to see the level that you can read up to. So that
Okay.
if there is any issue with your vision, we can then correct it early
Early enough.
enough for you. If there
Okay.
is any pathology to, or if there is any disease, then we can address it.
Okay.
Then after age 3, the next eye examination should be prior to you starting school.
Okay.
So by standard, before you send your child to school, you need to go to the eye clinic first,
Okay.
so that they can examine to see that the eye is 100% fit for school.
Okay.
Because about 80% of what the child is going to learn is through
Vision.
vision, or like visual way, is the eye that is going to capture. So you need to make sure that we do that examination before they start schooling. And after that, we want to examine you at least twice every year.
Okay.
So after that you've started schooling, that is up to age 100, at least twice
That's
every
every year.
year, you can pass through the clinic.
Okay.
Nti anyɛ koraa deɛ, or the twice and when to me once a year, that you should be able to pass through the clinic.
Okay.
So don't wait to get symptoms before you come. Once all call about, certain things can be happening.
Okay.
So we need to have that routine assessment.
All right.
Uh-huh.
Doc, thank you. I still want to ask more
Okay.
about the children
Okay.
issue. So, with regards to still on the children,
Okay.
what are some of the signs? Let's say I'm a parent.
Okay.
What are some of the signs I should look out for that might indicate a vision problem in my
Okay.
child?
Okay. So there are several signs that can prompt you that maybe my child is not seeing well,
Okay.
or is struggling with his vision. And one of them is squinting.
Okay.
There are some children, when they are looking at something at far, they squeeze their eyes like this.
Okay.
When they squeeze it like this, it makes things a bit
Clear for
clearer.
them.
We call it the pinhole effect. And when you squeeze your eyes, it cuts off the peripheral rays, which interferes with the vision.
Okay.
So when they squeeze like this, it becomes clear. When they open like this, it
It
becomes
can blur.
blurred. So once you see your child squeezing the eyes like this, you need to bring the child to the clinic for us to assess. It's most likely the child is having issues with the vision.
Okay.
And then aside that, to a child who always complain of headaches.
Okay.
Today, mommy, my head and all that. If the headache becomes too frequent, you need to come to the clinic. Maybe there's some strain in the vision. You need to come to the clinic. And aside that too, there are some children when they are reading, they skip letters and lines.
Okay.
Sometimes you will think that on your serious, the child is not paying attention. It's never like that. There are some children, there are some vision problems that causes that,
Okay.
astigmatism in particular. So when the child is reading, he sees eyes a double. So it sometimes confuses the child. Already first line, ubona was skip or second line,
Second line.
no escape letters maybe. Once you get that complaint from the teachers or from you yourself, you identify it, you need to bring the child to the clinic.
Okay.
And there are some children too, when they are playing outside, they are so happy.
Okay.
But as soon as they come to the classroom and it's time to read, they become sad, they become dull. Sometimes it's not because they are not interested in learning, it's because they are not seeing well.
Okay.
So they don't develop that interest, that energy to read
Read. Okay.
or for classroom activities. As soon as it break time, they are happy because that one they are walking around. So once your child demonstrates some of these things, you need to come to the eye clinic for the professionals to assess.
All right. So thank you very much.
Okay.
Please, during your submission before
And
this
then let
question.
me add one important thing.
Okay.
When you see that one of your child's eyes are not focusing well,
Okay.
you need to quickly bring the child to the clinic.
Doc, please, how will we know that it is not focusing well?
When the child is looking straight, you see that one eye is looking straight, the other eye is either out or in.
Okay.
That is strabismus. So, or share straighter, you expect both eyes to look
Look
straight.
straight.
But if you see that one is looking straight, one is turned in or
Or
out,
out.
then it means there is a problem.
Okay.
And that one is very important. So once you see that, don't wait so long, because if
Okay.
you wait for long, it becomes permanent.
Okay.
But if you come early enough, we can give glasses that will help to straighten
Correct it.
the other eye so that both eyes will now take focus.
All right. Thank you very much, Doc.
Okay.
Please, before this particular question, you made a submission that, I mean, the age that we should visit the
Okay.
clinic,
Yeah.
where you mentioned that at age 3, you have to visit the clinic, and before you start school, you have to come as well. So I'm sure maybe some of the private schools may have that eye clinic assessment in their school.
Yeah. Yeah.
So if my ward is going to this particular school and then they do the eye examination for him or her, and then he's able to pass through the exam, do I still have to bring my child to the clinic for, detailed examination by the
Yeah,
optometrist?
it's very necessary.
Okay.
Like I mentioned earlier, eye care, we are looking at two things: eye health and vision. The test, the vision chart that is mostly in the schools is to check their vision,
Okay.
but not their eye health, because those the teachers that are not professionals or the nurses there are not professionals to do that.
Okay.
So even if your child is able to read everything on the chart, it doesn't mean your child is 100% okay.
Okay.
You need to come to the clinic for us to go through the procedures. And usually with children, I mostly I will also add color vision assessment to it.
Okay.
We need to see whether they can see colors the normal way.
Okay.
But there are some children by birth they have color vision
blindness.
defect
Okay.
or color blindness. So with those children, sometimes they can confuse colors. So the teacher will tell the child to pick green, then you go and pick red.
Red.
And you think that the child was born, but it's never like that.
Okay.
So when we do that and we are able to identify that this child is having this type of color vision defect, then we can inform the teachers.
Okay.
So that when they are doing colors and the child is alternating some of them, the teacher will understand, in order not to blame the child or score the child lower.
Okay. Right. Thank you very much.
Okay.
I'm really learning a lot,
Yeah.
and I hope all of us are learning a lot.
Yeah.
We have a few more questions to go.
Okay.
We want to move to diabetes, because in your submission you
Yeah.
mentioned about diabetes
Yeah.
as one of the conditions that may lead to something that we may not be aware
Yeah.
of. So I have diabetes. Let's say I have diabetes.
Yeah.
So why does my doctor insist on an annual eye examination?
Okay. So, like I mentioned earlier, diabetes has so many effects on our eyes and our vision.
Okay.
It causes so many effects. Number one, it can cause your vision to be fluctuating. That is, today you will see very well, tomorrow your vision will be down.
Okay.
The next day your vision will come up. So some of them, when they come to the clinic, you give them glasses. By a month, the glasses is useless. They can't see with it.
Okay.
You do the test and the prescription has changed entirely. So once these things happens, we need to be of concern.
Okay.
And one major thing why we always tell diabetic patients to come to the clinic is it causes diabetic retinopathy and diabetic maculopathy,
Okay.
or in general diabetic eye diseases,
Okay.
which leads to visual impairment. Is one of the leading causes of irreversible blindness or visual impairment.
Okay.
Like I explained earlier, the blood vessels are all over within the retina.
Okay.
When there's diabetes, the integrity of the blood vessel walls becomes affected.
Okay.
So blood will start leaking.
Okay.
So where the blood pools, the cells there will die because something is covering them. They will not be able to work as they are supposed to.
Wait. Okay.
And aside that, if assuming blood is supposed to come to this part of the retina,
Okay.
and when it got to this junction, there was a leakage.
Okay.
It means the cells here will
Will
not
not
get
get
blood.
blood. Okay.
So they will die. There's
Okay.
going to be tissue necrosis and all that. And the nerve fibers, there will be so many changes. And sometimes the diabetes will cause swelling at the macula. The macula is the most sensitive part of the retina. That is why majority of the cells that helps us to see are located.
Okay.
That is the photoreceptor, the rods and the cones, especially the cones.
Okay.
Okay. When there's diabetic macular edema or when you develop diabetes, it can cause fluid to leak underneath the retina into the retina and cause this macular side to swell.
Okay.
So Bon said the macula that is supposed to be flat, then it bulges like this.
Okay.
So when that happens, the cells here will not get nutrition. So all the cells here will die and the vision will go
Will
off.
go off.
So diabetes affects the vision so much. And the good news is that these changes in the vessels, there are interventions that can be given to address it.
Okay.
We can do laser photocoagulation, that we can use laser to seal the leaking vessels. We can give injections of steroids to reduce the swelling of the eye. We can also give some injections called anti-VEGF, that is to prevent the growth of new blood vessels in the retina, just to save the retina.
Sure.
So once you are diagnosed with diabetes, coming to the eye clinic should be part of your routine activities.
All right. Thank you very much,
Okay.
Doc. So with all this, maybe somebody is watching, the person has not been visiting the clinic
Yeah.
and has now realized that you have to be visiting the clinic
Yeah.
annually in order to prevent other unforeseen circumstances
Yeah.
to our eyes. So what is one most important thing I can do for my eyesight today?
Okay. The most important thing you can do is to make sure that you have regular eye examination. You visit the clinic at least once every year. That is the most important thing. So you go to the barbering shop to cut your hair almost
Yes,
every
every
month.
month. Yes.
You go to the salon to do your hair, fix your nails, and all that. But in all these things, you need your eyes to see how beautiful you are or how handsome you are. So you need to make sure that you factor eye care into your routine checkups so
Okay.
that if there's any issue, we will be able to identify it. And I will advise your viewers to avoid self-medication.
Okay.
There are most of us, we always want the easy way out. When we have eye issues, we don't want to go to the clinic. We just want to go to a pharmacy, get medication, and that's it. But what mostly happens is that when you keep doing that, you'll be doing what we call symptomatic treatment. When in a no diclofenac eye drop, na pains no ko. Have you asked yourself what is causing the pain to come
In the first
in
place.
the first place? And most of our pharmacies too, they don't stock the needed eye medication. It is mostly antibiotics, gentamicin, chloramphenicol, gentamicin, chloramphenicol, and these drugs are antibiotics. They are for bacterial infections.
Okay.
But when you go with any eye complaint, many kikame, many pruncio, many ayakoko, they will give you
Give it to
these
you.
ones because that is what they have and they are selling it. But it doesn't help. When we continue doing that, we'll be building antimicrobial resistance. And that is why now most of the bacteria, the antibiotics are not effective
Okay.
because we are abusing it. Conditions that doesn't require antibiotic, you will see that they've given antibiotic. Sometimes a patient will come to us in the clinic. The person is a welder or ye jumana meta nibi etu akoto nenino so. The most important thing to do is for you to come to the clinic for us to remove that metal
Better.
from the eye. That is the most important thing. But they will not come. They will go and buy eye drops, gentamicin, chloramphenicol, and be applying it on the eye. Meanwhile, the foreign body is still on the eye. So they will use it for about 2 weeks and still they are feeling the
The
pain,
pain.
the discomfort, then they will come to the clinic. By the time they come, because the foreign body has been on the eye for long, it has caused much damage to the surface of the eye
Okay.
because it is something foreign. So it will be scratching the eye, causing the wound to go deeper. And sometimes when you even remove it, you see there's rust because the metal and the tears they will rust.
First.
So
Okay.
it will cause it brown on the eye, which can affect your vision. So we advise that if you have any eye condition, just see the professionals. Personally, I don't like phone calls. Doctor, many hear me say, Mami Edro,
You
just come
can't
to
do
the
it. Come
clinic.
so that they will use
Unless it is
machines to.
emergency, the
Okay.
best thing we can do is to give you something to relieve you of the pains at that moment.
Okay.
But you need to come to the clinic so that we can examine the eye proper. Because we have just two eyes, so we don't have to play with it.
So
I'm sure you know that we can do kidney transplant,
yes.
we can do liver transplant, we can do heart transplant, and even now the brain, they're even we're transplanting pig brain into human just to correct
Wow.
certain conditions.
Interesting.
They are doing that with our arms too. I've seen documentaries where they transplanted someone's arm to another person, the leg and all that. But there's one part of the body that
Yeah, you
they've not
cannot.
been able to transplant, and that is the eye.
I. Okay.
For now, there's no surgery that can be done to replace your eye once it's gone, which means that it is priceless, so we need to handle it with care.
Okay.
And that is why I would advise your viewers that if you have any eye condition, visit the nearest eye care facility.
Okay.
Let them examine you appropriately and then give you the right intervention. Don't just call and buy medications and all that. Go to the clinic, let them assess you and do the right thing.
Right. Thank you very much, Doc. It has
Okay,
been insightful, and we
okay,
thank you a lot for sharing this knowledge with us.
okay,
And to everyone watching, your eyesight is very important, so don't take it for granted. Make sure you visit the nearest eye care center as soon as possible, and if possible, regularly, so that you can take care of your eye in case of any emergency. Thank you. If you learned anything, make sure you like, you share, and then you comment. And then this is not the end. We are going to bring you more and more insightful conversations. Thank you very much. Bye.
okay. Hi, I'm Dr. Francis Redu, an optometrist with Healthy Eyes Eye Care and Optical Center at Cape Coast. At Healthy Eyes Eye Care and Optical Center, we provide comprehensive eye examination. We have the necessary machines and equipment to examine your eyes and be able to identify your condition. And we offer treatment to eye diseases such as glaucoma, cataract, conjunctivitis, and all other eye conditions. And then we also offer glasses, that is optical wares. We have nice designer frames. We also have all the various types of lenses, being it photochromic lenses, being it the blue block lenses. We also offer single vision lenses, bifocals, progressive, to meet all your optical needs. And we also offer specialist services such as binocular vision assessment. Those of us who sees double, we have specialists in that who can assist. We also provide contact lens services for those of us who want to use contact lenses. And aside that, we also offer home and then school or corporate bodies screenings. That is workplace screenings. We can come to your school, we can come to you at the house. If you cannot come to us, you just invite us, and then we'll come with our machines and our doctors to attend to you, to provide you with a holistic eye care and optical service. So at Healthy Eyes Eye Care and Optical Center, we say that we provide you an excellent care with a personalized touch. And we are located at Cape Coast, Paydu Junction, just adjacent to the Total filling station where the traffic light is. Adjacent to the Total filling station, that is where we are located. And you can reach out to us on the contact on the screen, or you can call us on 0546 303617. 0546 303617, and we'll be glad to offer you any help and assistance that you need with respect to your eye health and your vision. Thank you.